kind of authoritative style is wonderful for something like bruxism, because people who clench often need authoritative style. Okay? Permissive was a Dr. Milton Erickson, who really, this is where you can just kind of be talking to someone and use what they're doing, what they're not doing, to get them into a trance state. Okay, I'll let you know how I do this. You notice when I slow down my voice and lower my voice, that's what I do when I'm working with people. So we slow everything down, lower everything. We use what they're doing. If you're sitting in a chair, you say, exactly, you're not going to fall asleep, you're going to go into a trance. So I'm not going to do that fully, but we use how they are. So with your feet planted firmly on the ground and your hands sitting on your lap, and your back against the chair, you can start to feel relaxed and comfortable. But I'm doing it quickly. I usually do it slower and more rhythmically, okay? The stages of hypnosis are the induction, so getting you into the trance, the deepening stage where you do the post-hypnotic suggestion, use that, and the coming up, just getting out of the trance state, which you can use informally, or you can count, which is a typical way to do it. I'm not going to go over everything because there's a lot, and it's getting a little late, but basically, we do a great interview, and we're talking to the person as soon as they come in. It's sort of a pre-induction setup. You're letting them know that it's time to relax. You talk differently. You kind of talk about what hypnosis can do. Usually we're using almost always positive, always I'm going to say positive suggestions, okay? Body language is important, gentle, slow movement, a metronomic cadence. So you remember what a metronome is on the piano when you were a kid? So it's that kind of cadence, back and forth. I usually also, when I'm working with a client, I'll notice their breathing. There's a lot of observation. And I actually notice the movement of their shoulders. And often I'll speak while their shoulders go down.
Thank you.
And you notice they just start to let themselves go. It's really interesting. Very important for hypnosis is reframing. That's often what we're doing, right? We're reframing the way we're thinking. So we're using symptom substitution or a change in perspective to do that. We're using a lot of distraction and sensory confusion, okay, particularly with dentistry. Now we all know what distraction is, right? How do we use distraction in dentistry? There you go. First thing, right, in dental school, when you gave an injection, what's the first thing you learned? You're shaking the cheek, right? That's a distraction technique. So that's what we're doing also. We're doing pretty much the same thing. We're also doing sensory confusion. So you use as many senses as you can. Body, sensation. Again, this is more the pre-induction or mindset. You're developing a state of positive expectancy, leading to the acceptance of the trance state. So then they trust you at that point, and they'll let themselves go, obviously, and it will only help them. I explain hypnosis. It's a good time to start indirect suggestions. Tell people to let their imagination have free run. It's like, you can let yourself go. They start trusting you at this point, they can do that. An essential condition here is removal of doubt and fear and the fixation of attention. Okay? You want to kind of know they're with you a little bit. Most failures to induce hypnosis are the lack of adequate pre-induction or a perception of the lack of confidence on the part of the hypnotherapist. And that's pretty much the same with dentistry, isn't it? Right? If you don't seem to have confidence, the patients don't usually trust you as much. Again, induction. We're starting to speak. With me, it's mostly speaking. People start to relax. You're using language to focus on the person's inner experiences, their body. They start going inward, okay? And I can usually see signs of them relaxing. I notice their breathing slows down. There's different heaviness in their features. I just want to mention, hypnosis is using a lot of the subconscious, but there are many techniques you can use that are conscious, with patients. I mean, not every patient wants to be hypnotized. So I will often use visualization. Some of the techniques in hypnosis about a special place, I will ask patients to visualize their special place be a garden, by the ocean. You kind of mention general places and let them take over. This can help just on a conscious level. Also, I like some breathing techniques. Yoga breathing is like a 4-7-8 technique. This helps wonderfully with injections, by the way. You have them breathe in deeply for 4 counts, hold the breath for 7, and release very slowly for 8. Kind of lets their body go. Now, I'm just going to go over this briefly, but we're using a lot of repetition, a lot of rhythmic repetition. This is where the shamans in the old time used to use drums and such to go into their trances. Well, we're using our voices for repetition, and we're using repetitive words. In this part of the induction, to trance state, the induction, we'll use words heaviness, floating, relaxing. We can use ideas like golden light, clouds. Your thoughts can be like, be carried away on clouds. Whatever works, the golden light around you, a white light coming in, whatever works for that particular patient. You've talked to the patient before, so you get an idea what works for them and what doesn't. Right now, you're laughing, so probably the white light wouldn't work for you. So you get an idea of what the person is like, or what will they accept or not accept. Again, using time designation.